I'm Sarah Steele. This is CSV number 2 and we'll be operating under Ambulance Victoria's practice guidelines for the purpose of this scenario. As a MICA unit, we've been dispatched to a motorbike rider approximately 40 years of age. As we've arrived on scene, we've noted that we're in a high speed area. We have a solo rider lying prone on the road. Helmet is not worn. We've got debris scattered through the scene. CFA are managing debris and police are on scene managing traffic for us. We have an ALS crew that will be arriving promptly behind us. So we're going to proceed to scene. We've got our PPE on. We're going to be continually assessing for dangers and conducting a dynamic risk assessment throughout. So we're now going to arrive on scene. Looks like we've got a rider down here, Mike. A bit of a boggy mass to the back of his head here. Mate, can you hear me? It's the ambulance. We're here to help. Alright, I'm getting a bit of groaning.
Hey guys, my name's Heidi and this is Bronnie. We are let's back up.
Hi Bronnie, this is Mike, I'm Sarah. We've got a rider down here about 40 years of age. We're going to need to get him on his back to do our assessments properly here, so we're going to do a log roll in a second.
Righto, no worries.
So can I just get you to do a quick sweep of his back for me while he's in this position? And we'll get in position to do the log roll.
Look, there's no obvious bleeding up his back there, and I can't see any obvious bleeding on his clothes, on his legs anywhere, Sarah.
Excellent. Alright, so we're going to do our log roll in 2 stages, guys. Halfway and then all the way over. Watch your hands going under the patient for blood or any sharps.
No worries.
Alright, everybody in good position?
Yep.
Ready, set, go to halfway. No blood noted and no sharps underneath the patient. All the way, ready, set, go. Excellent. Mike, can you grab a towel to go under this patient's head for me? Ronnie, can I get you to grab the monitor for me, please? I'll get you to just chuck that on for me. I need SpO2, temp and BSL. That's it, straight under the head there. Can I get you to grab a collar for me, please, Heidi? And then I'm going to get you to start cutting off the rider's clothes.
Sure, no problem, mate.
Alright, so we've got a fairly major trauma area here, guys, and on mechanism alone, he's a trauma patient. Mike, I'd like you to get an IV in for me straight away.
Sure.
So, airway appears to be patent. Patient is observed to be breathing. I've got chest rise and fall. I can feel a carotid pulse. Brian, can you just quickly check a radial pulse for me there, please? So it feels quite rapid and thready here.
Yeah.
Excellent. Right, no obvious external hemorrhages. We're going to need to be mindful of our exposure. So once the clothes are off, Heidi, I'd like blankets on to keep the patient warm. I'm going to conduct a vital sign survey. I'm going to start with GCS. So no eyes open spontaneously. Mate, can you open your eyes?
Take 2 seconds while we'll get the clothes
No response to pain. Eyes are a 1. Checking for verbal.
Cool.
Can you tell me your name? Not getting any response. Applying painful stimuli. Can I get you just to do a nail bed pressure on that side as well, Heidi? So I've got flexion here as well.
Just
and
flexion on this side, mate.
Yeah, so I've got groaning to painful stimuli, which is a 2. So in terms of our motor response, we got a flexion, which is 3. So we have a GCS of 6. Patient seems agitated. So we're going to need to get on top of pain relief early as well. So I'm going to do my RSA here. So patient is unconscious. We're not getting any speech. Listening for sound. So a good air entry bilateral, no adventitious sounds. Normal respiratory effort in good tidal volume. So we've got a respiratory rate of 18, nice even rhythm. So our skin appears to be pale and clammy. I'm going to get you to get a blood pressure cuff on for me there, Brian, and get a BP.
Just
Sharp
a
out.
BP, just 90 on 60, and I'll update you with the rest of the obs when I've got them.
Excellent. So I'm going to do my full PSA. So skin is pale and clammy. Patient is still unconscious. So BP was 90 on 60 and monitors showing a heart rate of 131. So we've got a hypoperfused patient here. So we're going to need fluids drawn up but not running at this stage. Thanks, Hef. So we're going to do a secondary survey. Heidi, I'm going to get you to assist me with this, please.
No worries, I'll start on the bottom half.
Yep, excellent. I'm going to start at the head. So you can feel a boggy mass at the back. No blood on my gloves. Going to check the pupils. Pupils are equal and reactive to light. No blood or any grey matter noticed at the ears or in the nostrils. Okay, checking down the neck. No crepitus. Trachea is midline. No deviation. Feeling through the chest. No crepitus noted. Feeling down arms. Sorry there, Hef. Not noticing any deformity or bleeding. I'm going to check the abdomen. Abdo appears to be quite firm and rigid. Not noticing any obvious injury to the pelvis. How'd you go with the lower half? Heidi?
Look, left side is clear, no deformity, no bleeding, and he's got a good pedal pulse.
Yep.
Right side, there's a lot of deformity up in the high area of the right femur.
Yep.
And nothing, no obvious hemorrhage, good pedal pulse.
Yep, no worries. We can count that right femur as being the upper third.
Yes, I believe so.
Alright,
And
so
Sarah, there's a 14 gauge in with a bag hanging but not running.
yep, so we didn't notice any medical alerts, you didn't notice any identification or allergy notices in his pockets. So we can't assume that this patient has any medical history of medications, as we've got no one that knows him on scene. We also have to assume he has no allergies. So I'm going to get you to start running that fluid for me there, Hef. So guys, we've got a patient here that appears to have a
Okay, Mr.
traumatic
Fiery,
brain
can you
injury.
hold the fluid up for us, please?
We've got a traumatic brain injury, we've got an acute abdo, we've got a right upper third femur, so we can't use a traction splint because it's contraindicated, and we can't rule out that we don't have a pelvic fracture given the major trauma setting. So we're going to need to get a SAM splint on. We're going to have to go with anatomical splinting of the legs. Given that we have a TBI, our most important thing is going to be blood pressure. We need to get our systolic above 120 to maintain MAP. So we're going to have to go with, we can give up to 40 mils per kilogram, not including our RSI prehydrations. So we're going to need to target the blood pressure to 120 for me. So how did you go with your
Fentanyl?
CBODs there, Bryony?
1 and 2 mils,
We've
expired
got a
20
sinus
mils.
tachycardia
Expired
at
21.
130.
Sinus
Drawn up
tach
to
130.
Yep, SpO2 of
Let Sarah
95%.
Sarah, fentanyl drawn up.
Excellent.
BSL of 6.7, temperature of 36.7, and we've got a BP of 95 on 7.
I'm free if there's anything else you'd like me to do.
Yep, I'd like you to go give a sit rep for air for me, please, there, Heidi. I did get an ETA for them as well. So we're going to start our non-rebreather.
I'm also free, Sarah.
Yep, excellent. So I'd like 50 mics of IV fentanyl given for pain relief. So our patient's been a little bit combative, so we need to get on top of it. We're going to have to assume he's got significant pain with the injuries he has, and we're going to need procedural pain relief before we can start getting that SAM splint on. I'm going to apply a non-rebreather at 15 litres for oxygenation of this patient.
50 mics of fentanyl given.
Thank you. I'd like you to start preparing our RSI medications for me. So I'm going to need you to we're going to go with a ketamine succinylmethonium approach. I estimate the patient to be approximately 100 kilos, so we need 1.5 milligrams per kilogram of ketamine N for succinylmethonium. So I'd like 150 milligrams of each. The ketamine needs to be 150 milligrams in a 20 ml syringe, and the succinylmethonium needs to be 150 milligrams across 2 syringes.
Yes.
I'd also like atropine 600 mics in a 1 ml syringe, and please label and check all medications with Heidi.
Okay.
Can you give me the set of obs again there, Bryony?
Sarah, I've spoken. Hems is 18 minutes off Landy. They're going to land at the Oval, which is about a 5k drive from here.
Yep, excellent. I'd like you to get the SAM
Right, so
splint,
you-
SAM splint out for me, ready to go as well, and then you're going to assist Mike with the medications for the
No worries
RSI.
at all.
So that fluid's been running for me.
Sure. At the moment, we've got a blood pressure of 105 on 60 and a sinus tachycardia of 120, setting at 100%.
Sarah, he's not liking me putting this under him, mate.
Yeah.
He's quite cranky about it.
Yep, can I get you to give another 50 mics of IV fentanyl for me there, Heidi, which will be 100 mics in protocol, and start getting on top of that procedural pain relief. So a patient is responding well to fluid, so our blood pressure's improved. We've also still got a sinus tachycardia. We're going to have to assume that that's still related to pain, so we're going to really hit hard with that
Another
analgesia.
50 of fentanyl's been given.
Yep, excellent. So we need to make sure we've got another 100 mics of IV fentanyl ready to go. Bryony, can I get you to get another IV happening on that side for me, please? Large bore, fluid running through that one as well.
Yep.
I'm going to start pre-oxygenation for our RSI.
Hi, do you have a second? Can you check these
Yeah.
bags, please?
I've got that pelvic splint on, but he is really upset with me doing that.
Yeah, once we've got the fentanyl ready to go, can we have another 50
So-
mics for that, please?
Yeah, no worries. So ketamine, I'll just check this with you. So ketamine, 200 in 2 mils, drawn up to 20, and we've discarded the 5 mils, so we're at 150.
That's correct.
Cool. I'll just give this extra
Yep.
50 for Sarah. Sarah, another 50 mics of fentanyl going on board. The patient's now had a total of 150 mics of fentanyl.
Excellent. So noticing
Okay.
the groaning appears to be improving, so hopefully his
Succinylmethonium.
pain relief is getting more optimised.
150, we've got 3 mils drawn up.
Correct.
Sharps
Cool.
out.
So,
Yep, excellent.
That with the fentanyl.
and Sarah asked us to draw up another lot of fentanyl
Oh,
as
did she?
well. Yeah.
Okay, I can do that.
So,
And
And
you check the others too.
and the atropine 600 marks in 1 mil, so it's ready to go.
And the rock uranium, which is not drawn up.
Rock uranium,
Alright.
50 milligrams in 5 mils, expire 2021, not drawn up but sat to the side. Fentanyl, 100 mics,
Sharps are
2
still
mils,
out.
drawn up to 10, expire
Sharps are out.
2021. Yep, I'm happy with that. We'll just get rid of our sharps to the sharps container. That's another lot of fentanyl ready to go.
And I'll get you to hook up the end title when you're free there, Brian. Sharp away.
Sharps away.
Sarah, the drags are all drawn up, ready to go. Heidi's checked it with me.
Yep.
Just trying to get that anatomical splinting done for you,
Yep.
Sarah.
So
That you
it
asked
appears to
for.
be much more relaxed now.
Yep.
So just looking at the updated blood pressure now appears to be 120 on 90, heart rate is sitting at 110. Patient no longer appears to be as clammy, but it still appears to be pale. So we're having good response to the fluid.
I'm just securing this IV and then I'll get your end title.
And I'll get you to start getting the RSI equipment ready for me, Mike, and we'll
Sure.
go through a full checklist before we're going to proceed.
I haven't got the fluid.
So I'd
for
like a
this
size
line
8
or
and a
the
size
mask either.
7.5 tube.
Yep.
Can I just get you to plug in the end title for me, please? That's right, Brian's got it. Okay, you can proceed with the RSI equipment.
I'm now free if there's anything you want me to do.
So our SAM splint anatomical splinting's done.
Sam splint's done. I've got a towel between the legs. I couldn't find some triangular bandages. I'll get it in for you and get that done.
Yeah, I'm going to get you to do the RSI, the post-medication that we're going to get ready.
Certainly. What would you
So
like?
I'd like rock uranium 50 milligrams drawn up. I'd also like our infusions going to be fentanyl and midazolam. So I'd like 300 mics of fentanyl and 30 milligrams of midaz drawn up to 30 mils. Do you understand how to do that?
Yes, I do. I've done that before. And your mica partner got me to check the rock uranium with him earlier. So it's ready. I'll do you more from your fentanyl and midaz you want.
Fentanyl and midazolam, yes,
What's
please.
that again?
So it was 300 mics of fentanyl,
Yep.
30 milligrams of midazolam, drawn up to 30 mils in
No
a
worries.
50 mil syringe. for
Okay,
me.
I'll do that for you now.
So we've been pre-oxygenating for 2 minutes, guys. So well underway. Can I get the next set of obs,
Yep,
please?
we've got a BP of 120 on 80, SpO2 of 100%, heart rate is sitting at 110 sinus tap, and we've got an end title of 35.
Excellent. So we've got normotension. Our tachycardia is resolving. Skin is consistent with that improvement in hypoperfusion. We're setting at 100%. We've got a good
Just
end tidal
quickly,
waveform. Assist
15
ventilating.
milligrams in 3 mils of midaz times 2.
Yes, that's correct.
Expire 2021.
Yep.
And I've got 3 10 milligram in 1 mil.
Did you still want me to get that
Fentanyls?
fluid?
So
Yes.
just
Yes, I'd
confirming,
like the
and all
fluid ready,
expire
please.
2021. So she
Yes.
asked me for 300 of fentanyl, 30 of midaz, made up to 30.
That's
Yep,
correct,
I'll do
yes.
that now.
You right with that?
Yep. So no longer getting any groaning or combativeness. Patient appears to be much more relaxed now that we've got pain relief on board. So, and Brian,
Okay.
I'll get you to do 5-minute obs for me once you've got that fluid tacked up.
The intubation gear is ready.
Yep, excellent. So I've got my checklist in my pocket here, I believe. Here we go.
So
You want
yep,
this
that's
running?
made up
Yes,
to
the
that's
checklist.
made up to 30 now.
Fluid's running wide open.
Correct.
Excellent.
Outside.
Wide open? Right, and 5-minute Leons.
And I'll just go
5-minute obs, please. Make sure you get my attention for
Line's
them.
primed.
So, patient's well rugged up, so
Do you
we're
want that
preserving
started,
normal
do you,
thermia.
or it's drawn up ready? What do you want me
No,
to do with
that's
that?
going to be post-intubation sedation.
Okay.
So like prepared, but to the side, please.
Okay,
So when we give that, we need to make sure that there needs to be a 0.8 bolus given prior to the sedation infusion being set.
Okay, no worries. So that's ready for you now. I'm free if you need me to do
Excellent. If
anything.
everybody's happy, we're now going to work through the RSI checklist.
Mhm.
So we're going to need to work through our roles as well. So Mike will be assisting me with the RSI. So we're going to attempt to proceed with a bougie attempt first. So once I've got visualisation of the cause, I'm going to pass the bougie. And then once I've confirmed the placement, Mike, you're going to pass the tube over the bougie. Once I confirm I have the tube, you're going to then very slowly remove the bougie once I've confirmed placement.
Yes.
You're going to assist to tie it off. We will confirm placement post that.
Yeah.
So Bryony, your job's going to be to continue to monitor the patient's OBS.
Yep.
If there is any bradycardia at any stage, your job's going to be to notify Heidi, as she's going to need to give atropine at that stage.
Sure.
So you're also going to monitor the end-tidal waveform to note that that's gone. So Heidi, you're going to be on medications. I would anticipate that we start to see fasciculations and loss of jaw tone within 60 to 90 seconds of the ketamine and succinylcholine being on board.
Yep.
And our atropine's only be given if we become bradycardic at any stage.
Right. Yep.
All right, is everybody happy with their roles?
Yes.
Excellent. Can we proceed with the checklist, please, Heidi?
Certainly. So RSI challenge response checklist. Contraindications or precautions, any?
Not relevant.
No. Optimised
Patient is
position?
optimised considering spinal considerations.
Yep. Yes, so C-spine considerations.
So we have been. We're now going to remove the collar, and Mike will get you to check the cryo membrane and mark that as you remove the collar, please, or undo the collar, should I say.
Okay, oxygen supply sufficient.
Correct, yes. We'll be pre-oxygenating now for 5 minutes.
Bag valve mask peak 5 centimetres of water.
Yes, correct.
Nasal prongs at 12 litres.
Yes.
IVIO access times 2.
Yes, 2 IVs.
Normal saline at 20 mils per kilogram.
Yes, we've had our prehydration as well as other fluid for the hypofusion.
Yep. Drugs and doses identified for the RSI.
Yes.
Standard video laryngoscope times 2.
So we have a standard and a video laryngoscope, yes.
ET, one smaller, one larger.
Correct, yes.
Introducer stylet.
Yes.
Bougie.
Yes.
Tube tie, sleek and a 10 ml syringe.
Yes, correct.
Suction tested and functional.
We have suction ready. Can I get you to place that to my right, please, Mike? And I would like the suction yanker placed to the right of the patient's head, please.
Functional electronic capnograph.
Yes, correct. So end-tidal's currently 35.
OP airway.
OP, yes.
Adult monitor mode.
Adult, yes.
SATS licorice stick colorimetric capnography.
Yes, all of the above.
Eye gel and lube.
Yes.
Crike kit and location marked.
Location is marked. Can you get the cryo kit out, please, Mike?
Post intubation. Long-term paralysis.
Yes, rocuronium prepared.
Yep. Infusion sedation.
Yes.
Nasogastric OG tube.
Yes, correct.
Any trials to consider?
No trials to consider. So at this stage, we're just going to repeat our full vital signs. So I'm noting that our blast blood pressure is 120 on 90, heart rate of 110. Patient's skin appears to be pale but no longer clammy. So we're going to can I get you to grab the stethoscope off my neck,
Yep.
please there, Heidi? And I would like you just to repeat assist with the RSA. So you're going to auscultate. So we've already covered off our skin, blood pressure and conscious state.
Yep.
So listening for sounds, we don't have any speech to consider. Still got good tidal volume, normal effort, normal rhythm. How do you go with sounds there?
Chest is clear through the bases, Sarah.
Actually, we're just going to repeat our GCS.
Yep.
So we have, our eyes are not open spontaneous. Can you open your eyes for me? Nothing to voice. Can I get you just to squeeze the trap there, Mike? So no eye opening at all. So that's a 1. So in terms of verbal, can you tell me your name? So I'm still getting some incomprehensible sounds, but I'm not getting anything else. So can we do a motor response there, Heidi?
He's not withdrawing, but he is flexing on the right. Not withdrawing, but he is flexing on the
bilateral
left.
flexion, which is a 3. So we still have a combined GCS of a 6. So we're happy to proceed with the RSI now. So I'm going to get you to give the ketamine and the succinylcholine, please, Heidi. Bryony, can you please note the time? And you're now going to be continuously monitoring our OBS.
Ketamine going on board now, slowly.
So 150 milligrams of ketamine.
Is going on board now. Ketamine is on. First 100 of the succinylcholine in the first syringe going through.
So 150 in total, 100 to commence with from the first syringe, 50 from the second.
It's on. Last 50 going through. Succinylcholine is now on board.
So I'm monitoring for our fasciculations, loss of jaw tone, and we'll be monitoring for a loss of end-tidal as well. Noticing the fasciculation, starting to lose jaw tone, end-tidal waveform appears to be dropping off. So, and we're at a minute, so we're going to proceed now. So you're going to disconnect the mask there, Mike, so that you can attach that to the tube. Alright, and confirm I can visualise the chords. I have a grade 2 view. Can you pass the bougie to me please, Mike? Visualising passage through the chords. Happy with the placement. Can you start feeding the tube over now please? I have the tube. Visualising it passing through the chords. Alright, you can now remove the bougie and inflate the cuff for me please. Alright, I'll have the mask attached now please. You actually just need to connect the mask there and I'll have that reattached to the BBM.
That's what I did wrong, sorry.
It's okay. Sats are still good, Sarah.
Thank you. So, still got sats of 92. Alrighty, so I'm getting good chest rise and fall, misting of the tube. Can you get the tube tie ready for me there, Mike? So, going to get you to listen for the sound on the chest there, Heidi, and to confirm that we haven't got gastric placement. So I'm getting a return of end tidal, so we now have 3 positive waveforms. End tidal is at 32. So I'm happy that we have positive placement. How's the sounds there, Heidi?
Good air entry to the top. Yeah, good air entry and nothing within the gastric.
Yes, excellent. So I'm happy that we have positive placement. Can I get you to redo the collar there for me, Heidi?
Yep.
So we've got our tube tied off. So we're going to start our post-intubation sedation. So we need to give a bolus of 0.8 mils first.
Yep.
And then we're going to start the infusion. We'll start it at 5 mils.
Right.
So just have that come loose just momentarily there. So Heidi, can you give me a full set of vital signs again, please?
Sure. So we've got a blood pressure of 120 on 70, saturated at 99%, heart rate of 110 still in a sinus rhythm, and end tidal of 35.
Yep. So we have an end tidal of 35, which is an appropriate target. We're setting at 100%. We're normotensive. Our tachycardia is resolving. Patient no longer is clammy. Does appear to still be somewhat pale.
Bolus of 0.8 is on and commenced at 5, you said?
Commenced at 5, yes,
Right.
correct, please.
It's
Happy with our placement. So we're going to
it's now running.
aim for a tidal volume of 6 to 7 mils per kilogram. So we're going to continue to monitor for any signs of chest trauma. So continually reassessing. We need to be mindful of our tube placement throughout. Can I get you to give the rocuronium as well there, Heidi?
Yep,
So-
certainly.
And Mike, what I'm going to get you to do is go grab the spine board for me. We're now going to start working on our extrication. We'll back mat the patient. We'll give an update to air.
50 milligrams in 5 mils, expired 2021 rocuronium.
Rocuronium confirmed.
Drawing it up now. And just confirming you want the full 50 milligrams given,
Full
Sarah?
50 milligrams, yes, please.
Okay.
And we're going to start to get ready to load our patient.
Rocuronium is on now. If you can mark the time for Sarah Bryning.
Sure. 10:57.
So we'll start working towards our extrication now. Thanks, guys. Very good. We're going to start working on extrication while I place the orogastric. If I can get you to just take over.
Certainly. I'll come and just scratch the side now.
Take over the BBMs for me there, Heidi.
Yep.
Sorry, and I forgot to mention that we were going with noting the length at lips to be 22.
What rate are you wanting me to bag this man at?
So we'll go for 12 at this stage, Heidi. 12 breaths per minute.
Got that
Positive.
extrication gear here, Sarah, when we're ready.
Yep, excellent. So I've placed the orogastric. I'm just going to draw that off. And I've got aspiration of gastric contents, connecting the bag now. Alright, so we've got our spine board ready to go. We'll start our extrication. Thanks, guys.